Hi, I'm Dr. John Martin with Ivy Family Health Updates, and I'm here today with my sister, Dr. Catherine Martin, and my brother, Dr. Edward Martin, and today we're going to be discussing hair removal. Hair removal has become a very big industry, especially in the United States, because a lot of people want to take unwanted hair off of their body. For women, it's often the underarms, the bikini, and actually a lot of women have facial hair that can be unsightly and difficult to cover if they're wearing makeup. For men, it tends to be either a lot of hair in the back or a lot of hair in the chest, and they either want to get rid of it or at least thin it out. Now, there are different options for hair removal. Obviously, the easiest would be just to shave your hair, but it will grow back in anywhere from 6 hours to a few days, depending on the rate of your hair growth. You can tweeze the hair, you can wax the hair. There are chemical depilatories, which you put a cream on and then you rub it off, and the hair will come off with it. But those can be pretty irritating, and I know a lot of people cannot use them because of the irritation. There is electrolysis, where you go individually and kill the hair follicles, and certainly the most popular these days is laser hair removal. Now, there are a lot of different lasers that you can use for laser hair removal, and sometimes you'll have to try different lasers to find which one would be the best for you. And the way that laser hair removal works is that your hair, you see the hair up on top of the skin and the follicle is down below the skin. The laser energy is going underneath the skin to kill the pigment in the follicle, and that's how the hair will die. And they all work on that same, what we call selective photothermolysis. And what you want to do is kill that hair follicle. Now, some of the hair is growing and some is at rest, and it only treats the actively growing hair. That's why you need to do multiple treatments. So you treat one group, the actively growing hair will fall out, and then in a few weeks, the next batch will start to come in, and so you really have to come back on a regular basis to kill the hair. The other thing that's important is that because it's the pigment that is going to absorb the laser energy, it really works best for dark hair. So if you have blonde hair or white hair, it's very, very difficult to get rid of it. And it works best on fair skin, because if your skin is dark, your own skin pigment is competing with the hair pigment, so you can't really go to a high enough energy to effectively kill the hair pigment without burning the skin at the same time. So the best person would be someone who has very light skin with very dark hair, and the coarser hair works well too. As you do the treatments, what you will notice is any hair that does come back will tend to be finer and thinner and often lighter. So sometimes you may not get rid of all the hair, but at least you don't see the hair very well. What I want to do now is just show you how the laser hair removal process works with our intense pulse light machine. What you see here is a test spot on a leg, and what we've done is lasered this area on this leg about 4 times, the last time being 2 years ago. And you can see that there's still a little bit of hair growth, but it's very fine, it's very light, so it actually works very well. And this is on someone who doesn't even have really dark hair. It's sort of a medium brown hair, but the skin is light, so that's why it has probably worked as well as it does. And what we'll do now is just show you how the machine actually works. Now, when we do the laser treatment, what we do is go over each area twice. It's very bright. You just move along in a pattern. And what this does is a very bright light source goes through the skin, and that laser light is going to be absorbed by the hair follicles. Follicles will die, and over the next few days, that hair will grow and just fall out. It's relatively painless. And you can see afterwards, there's really very little inflammation from this process. The machine that I use for hair removal is the Palomar. It's an intense pulse light system, and what this does is the handpiece screens out certain wavelengths of the light, and these are the ones that we have found to be the most effective for hair removal. This machine also comes with other hand pieces, so you can also use it to get rid of brown spots, to get rid of blood vessels on the face, and a variety of other things. And whenever we do these treatments, we make sure that we do wear protective glasses, because the light, as you saw, is very, very bright. So both I wear the glasses and the patient wears the glasses. I've tried a lot of different systems, and I think the intense pulse light system is actually the best for hair removal. Is there such thing as permanent hair removal or 100%? the FDA classifies it as a certain percentage of hair loss for at least a year. So even when people say permanent hair removal, it doesn't mean that you're going to lose 100% of your hair. Some people will, but a lot of people, even after 5 to 8 treatments, which is what you usually need to do, will still have some hair growth.